Hey, this is Diane from the Badass Breastfeeding Podcast, and I'm doing a mini podcast for you today, and we are talking about pain with latch. So the biggest confusion, I think, with pain with latch is that there isn't supposed to be pain with latch. Often when I do breastfeeding classes, that's the biggest thing that comes up is there's going to be pain, there's going to be pain. There should not be significant amounts of pain when you are latching your baby or when your baby is feeding. What you will most likely feel, now everybody's different, but what you will most likely feel is, when you're first starting to latch your baby in those first couple weeks of your baby's life, you will latch the baby, and if you feel maybe a little bit of tenderness or a little bit of sensitivity there, and you might go, kind of wince for just, 30 seconds, maybe a minute tops, then it should be gone. And that should be it. But we call that initial latch on pain. And that initial latch on pain, your body's really sensitive. You just went through childbirth. There's lots of hormonal changes happening. So we do expect there to be a little bit of that, tenderness when the baby is first latching. But then during the feed, you should feel nothing but just a pull or a tug. It shouldn't be painful. No pinchy, no, burning feelings, nothing like that. You should not feel any kind of pain like that throughout the feed. If you do feel pain that lasts throughout the feeding, that is a sign that we need to fix your latch. And we need to look and see what is going on with that latch. If you tell somebody this is painful and they say to you, oh, but you're breastfeeding, it's going to be painful. That is not a good answer because it shouldn't be painful throughout the entire feeding. That is definitely, keep that in mind. That is a huge red flag. If you take your baby off, and the nipple is flattened or creased, then that is also a sign that we need to fix that latch because it's going to cause you some pain with your latch. So bottom line is that you should not have pain with your latch that lasts throughout the feeding. It should not last the duration of the feeding. A little bit of pain in the very beginning is normal. It should not last throughout the feeding. Sometimes moms will have discomfort on one breast, but not on the other breast, and that might just be a positional thing. So you can just kind of switch positions and try different positions and see what works best for your baby. But there should not be pain, and I don't want anybody to feel like they have to go through some kind of painful, experience. I don't want anybody to feel like they have to go through a painful experience just because they're breastfeeding and it's like their rite of passage and that's what they have to do. That's not what it's like. So when you are breastfeeding your baby, keep that in mind. Big red flag that if you have pain that lasts throughout the whole feeding, that is when you need to definitely find some help for your latch. And thank you. You can go ahead on the Badass Breastfeeding Podcast and find our episode on latching and pain and painful breastfeeding, and you can check that out. Thanks.